Watch this.
More cuts to Medicaid could be coming soon, and they're concerning cancer patients. First, we saw some state cuts. Now, the federal government has the idea taking shape. A different health concern that doctors didn't think they'd have to worry about. It's back in the headlines. Yeah, we're talking about measles, and there are outbreaks across the country. Idaho so far has missed out on it in a good way, but there are some data points that could prove to be concerning. How do you live to be 100 years old? Well, try not to get sick, and according to Esther, who just joined the Triple Digits Club, don't eat squash. We got a special celebration just ahead.
We need this safety net program in place. We have to have it. We just need to make sure that we're not going to burn it all down while trying to keep this.
That was Representative Jordan Redmond, who led the effort for House Bill 345 this past legislative session. It creates a work requirement to stay on the Medicaid expansion program in Idaho. It passed the Idaho legislature just months ago. Governor Little signed it into law with the intent to prevent a runaway Medicaid budget. Medicaid conversation has not stopped there in Idaho. We know that federal lawmakers are now considering significant cuts to the Medicaid program. The proposed $715 billion in cuts would result in millions across the country losing the coverage that they know right now nationwide, an impact that hundreds of thousands of Idahoans could possibly feel. As Aspen Shumpert learned, Idaho doctors are raising concerns on this, and local cancer care advocates warn of the effects of these proposed federal cuts.
There could be an increase in anywhere from 8 to 13 million Americans that become uninsured over this.
Dr. Ted Epperly has been an Idaho physician for 45 years. He says he's seen the effects that come with the lack of insurance.
If you don't have insurance, then you delay care. You don't seek care for minor problems. You don't get chronic diseases managed in a timely way.
Medicaid is a safety net for that, he says, a net more than 300,000 Idahoans rely on.
Typically, most people are at 138% of the federal poverty level. That, for a single individual, is probably right around 20,000, or for a family of 4 at about 40,000. So people in that income level will qualify for Medicaid. And that's an important age group to have coverage for.
Randy LaSalle from Bliss, Idaho, is a single mother, and her 12-year-old daughter was born with epilepsy.
If she didn't have Medicaid, the amount of tests and the doctor's appointments and the medication, I would not have been able to afford it.
Today, her daughter still relies on Medicaid. LaSalle worries for her daughter if the federal government approves the $715 billion cuts to the program.
They need to think about, would they rather lose the dollar and save a citizen, or lose a citizen to save a dollar? Because that's really what they're doing.
If her daughter is cut, they are facing some tough choices. LaSalle possibly needing to get a second job.
You have to choose between, whether your kids are going to be able to do their extracurricular activities, if you're going to be able to get those extra groceries or pay a bill, or if you're going to be able to get to work because you can't afford gas because, you got to pay almost $800 a month in insurance fees.
The American Cancer Society Cancer Action Network in Idaho is also sounding the alarm on these cuts. Randy Johnson with the Society and Network says they expect nearly 12,000 people in Idaho will receive a cancer diagnosis this year.
And these are cancer patients, they are children, they are veterans, they are the people that are working down at the Jacksons down the street or at Walmart. These are people we see every day. And just to pluck them and say, good luck, pull yourself up by the bootstraps, that doesn't seem like a very good system.
Johnson says 1 in 10 cancer diagnoses are treated under Medicaid.
That's a scary thought of what we're going to see if these cuts go into place. We're going to see people that don't have access to health care. We're going to see people who are going to get sick, who are going to hear those words, you have cancer, and have no way to navigate that.
Dr. Epperly says these cuts are something every American should be concerned about, not just those in the program.
When you shift that much money out of a healthcare system, what then happens is patients both live sicker, go in later, have high cost. They will not be able to pay for that. Hospitals and providers will not be able to get paid for that. What will happen is the cost shift that will start to raise prices for everybody else. And so having an intact, robust system will actually be the best mitigation to keep people as healthy as possible, but to keep overall health costs as low as possible.
Dr. Epperly wanted to point out is the larger effect this will have on rural Idahoans that depend on Medicaid. They could have to drive further for care or not seek care in a timely manner. Also, if rural providers and hospitals see a decrease in payments into their systems, they could start cutting services. Access could not be as accessible. Both Dr. Epperly and Johnson with the Cancer Society are not against looking at alternatives to improve Medicaid or ways to tackle it, but they really are against this large of a cut.
It's interesting, too. I know that some viewers asked when we had the conversation about state cuts is, well, why are they looking at Medicaid? And, you know, it is a large budget item, and you could hear some people in Congress testify, say, well, would you rather us cut Social Security? So as the federal government is taking a look at cuts, this is an easy one to look at in that sense in terms of it being a large budget. We will see, though, if it actually passes.
Waiting to see what happens with that.
All right. Aspen, thank you so much. Exciting time of year, nicer weather, kids getting out of school, time to head out to summer camp, summer vacations. I don't want to be the buzzkill here, but there is something that Idahoans should have on their radar. Maybe you got a message like this one from your healthcare provider. Take a look, a little pop-up reminder in my chart. Getting a vaccine for the measles is a good idea because just in the last several weeks, 3 Americans have died of measles, 2 kids and an adult. Those were in the states of Texas and New Mexico. And traveling from Idaho to places with outbreaks, more than 30 states at this point, it carries a risk that Idahoans will bring it back with them during this high-volume travel season. And health leaders in Idaho are making a strong push to avoid that. The Gem State, unfortunately, has left the door open for an outbreak. Things have changed in recent years. There was a time in America that measles was just part of life. Hundreds of thousands, including many children, got the disease, and thousands died. But a campaign to stop measles kicked into high gear with the creation of a vaccine in 1963. Slowly but surely, case numbers went from hundreds of thousands in the 1960s to less than 500 in 1996.
In 2000, CDC declared that measles wasn't circulating in the United States anymore, so we had eliminated measles from this country. We continue to have cases every year. These were travelers coming back who had maybe gotten exposed overseas. But 2024 and 2025 are starting to feel different.
Dr. Christine Hahn is the medical director of Idaho's Division of Public Health and the state epidemiologist. Measles is back on her radar, concerning trends across the West.
So we're seeing outbreaks, more and more outbreaks than we've seen before. We think that's a combination. People are getting back to travel after COVID. And immunization rates have dropped, and fewer people are immune nowadays. So when somebody does get measles, they're more likely to spread it to other people.
An outbreak in Texas led to the first American pediatric measles death in 22 years. Thousands of people have been infected across 31 states. Not in Idaho, but there is a data point that is concerning for Idaho in the conversation.
Measles vaccination rates were doing pretty well until about 2019, 2020, when COVID started hitting. In 2020, we saw a drop.
CDC data shows that Idaho has a declining vaccination rate for measles and a growing trend of vaccine exemptions for kindergartners. 2024 data has Idaho at essentially the lowest vaccination rate in the country for measles. Percentage-wise, 79.6%.
It's discouraging because it was so exciting to feel like we had eliminated measles, and measles is such a serious disease. It's discouraging to see the disease coming back. I understand people haven't seen measles. They haven't experienced it. But I'm hoping that as people educate themselves about the disease, they hear the reports from Texas and elsewhere about kids in the hospital or kids dying, that they take the time to learn about it.
Education is key in this conversation because an idea still floats out there that the measles vaccine causes autism.
That has been debunked. There have been lots of studies since then showing that that's not true, but there was a little bit of a hesitancy around that vaccine already. Then with COVID, I think people just became more concerned about vaccine safety in general, started questioning the childhood vaccines they were getting, so I think we saw another drop off around that time.
So in the public health conversation, this is a prime example of the COVID backlash. And the concern in the coming months is people will travel to areas impacted by measles, bring it back to their communities in Idaho with low vaccination rates. And it's not a what if. This happened in 2023 across southwest Idaho. A person brought measles back from a trip to Europe, and it's highly contagious. That's one of the big problems. And I know someone watching this will say, well, people will get measles and they will be fine. And that's true. Plenty of people will, but it's hard to know who will do fine and who will end up in the hospital or who could possibly die. Just this year, 2025, 13% of American cases of the measles resulted in hospital stays. So the information you need to know: when kids turn 1, they are eligible for their first dose of the measles vaccine. It's the MMR vaccine. They can get the second dose at about age 5, heading into kindergarten. Adults, you can go get the vaccine, no problem. Even if you already had it or maybe you don't remember, there's no risk of being over-vaccinated for MMR. All right, post-election hangover, right? Everyone stayed up late to watch the numbers. The May consolidated election is in the book, so let's see what happened out there. We'll start in Canyon County. Voters passed a nearly $8 million temporary levy that will now pay for more paramedics, ambulances, and ambulance stations, I should say. Voters did not pass a $2.25 million levy for the Star Fire Protection District. It needed a 2/3 majority to pass. The Middleton Rural Fire District's $2.25 million levy also failed to get a 2/3 majority, so there are questions there about what will happen. Middleton, the school district levy, also failed to pass with a 2/3 majority, although close to half the community was in favor. We'll see if they run it again. We did have a couple winners. Valley View passed a 2-year, $14 million levy that largely funds school staff. The levy will cost taxpayers $65 per $100,000 of assessed property value. The Fruitland School District levy also passed. It'll help pay for new math curriculum, help replace the high school track and football field, pay for new band equipment, and eventually overhaul the English curriculum. For all election results, you can head to our website, ktvb.com. We also have them in Spanish on KTVB in Espanol. Well, what else is going on around the great 208? City of Troy in some legal trouble. On the other hand, you can start learning about Idaho's rivers in a new mini-series. Our Morgan Romero gives us the lowdown in today's 411.
A Northwest Nazarene University student died because of a diving incident in Ecuador over the weekend. The university says Serena Bennett, a recent graduate and wildlife biology major, died on Sunday during a group dive off the coast. She was one of several certified divers, including students and faculty. The Department of Justice is suing the small North Idaho town of Troy because they say Troy discriminated against a Christian church and violated the Religious Land Use and Institutionalized Persons Act. In the lawsuit, Christ Church said they outgrew their current space for worship and tried to find a place to rent in a commercial area. However, the city denied the request, saying people living there opposed granting the permit application for the controversial church. Did you know Idaho has 3,100 miles of navigable whitewater? Not many people do, which is why Visit Idaho created a 6-part mini-series highlighting Idaho's legendary rivers. Every Wednesday, starting today, a new episode will drop, highlighting the wild rapids and rich stories of one of Idaho's rivers. Today's episode takes you down the Selway. Just check out Visit Idaho's YouTube page to watch for free. That's the 411 on the 208. I'm Morgan Romero.
Imagine the world in 1925. This program wouldn't even be in color, or likely even on the air. Maybe as a radio show, but local news is so 1940s. And today we spoke with an Idahoan that could probably tell you that firsthand. We are celebrating a special 100th birthday just after the break. Something else to celebrate or know about? Likely. We meet a lot of people in this line of work, people with stories to tell, some joyful, some painful, but it is often rare to meet someone who's seen more calendar pages turned than most of us ever will. And you can live a lot of life in 100 years. Today, our Hunter Funk met with a woman in Eagle who hit that century mark, who is funny, sharp, and has a few thoughts on the best ways to live life.
Do I look fat?
No, you do not look fat.
Esther Jocelyn didn't ask for a fuss.
Do you love the attention that today brings?
No.
But if you live to 100, you tend to attract attention.
Not really. I'm not used to all this attention.
What are you going to do tomorrow when you don't have all the attention?
I'll be bored.
100 years old today, but her spirit hasn't aged.
I don't feel 100, but I guess I am.
Ask her how old she feels.
85.
Yeah.
Her life story started in Montana.
I was raised in Dillon, Montana, just over the border. And I went to school there. I came to Idaho in 54.
After she and her husband had enough of Montana winters.
It's too cold in Montana.
Raising her 3 kids, she also worked for the National Guard and spent nearly 3 decades with the Bureau of Reclamation. Now retired.
How many people had their driver's license good till they're 100?
And somehow licensed to drive.
It's good for 4 years.
She recognizes
a lot has changed in 100 years.
From Model T cars to now self-driving cars.
That's crazy. I'd be afraid to ride one.
What she isn't afraid of is speaking her mind.
I don't drink any soft drinks. Never have. And I eat everything.
Well, everything but.
I don't accept squash.
You don't like squash?
No. And they found that out here. Oh, no, squash. Ooh. And they serve it often. He's got to get rid of squash.
I know, I'm going to tell him.
Yes. Well, that would be my legacy. Get rid of squash.
A century of life has taught her a lot, and her biggest takeaway:
just live and be careful. Don't get in accidents.
Now we'll get out of your hair.
Oh, good.
Oh, good.
Oh, good.
And the mayor of Eagle today has officially proclaimed May 21st, 2025 as Esther Jocelyn Day. A huge milestone, to say the least.
Yeah, and Esther, thank you so much for your time today. I really enjoyed watching that. That was fun.
Right, isn't that super cute? Also, while I've got the birthday shout-outs, it is my brother's birthday today and my mom's birthday tomorrow, so happy birthday to you guys.
And there'll be 100?
No, no, they're like in their 20s, yeah, we'll say. My mom's in her 20s.
We can circle back to when they're 100.
Yeah. Yeah.
All right. Thanks, Hunter.
And happy birthday, Esther.
Happy birthday, everyone. We'll be right back.
whether it's enjoying this stunning city of rocks like in those photos we just saw, or maybe just your back patio, it is a beautiful spring afternoon for anything outdoors. We're at 68 in Boise, lots of blue sky to enjoy. Sunny in Twin Falls where it's in the mid 60s. McCall sitting at 56 degrees right now. A gorgeous afternoon around Sun Valley where it's in the low 60s. The rest of our evening, nice and quiet. So your Wednesday looking good. We'll have a few clouds though that will start to build in as our evening progresses. That is our first indication that a little bit of a change is in the works for tomorrow. We're watching a system, the core of which is pretty far off to the west, but already we're seeing this preceding edge here of this trough. Showers moving into western Oregon right now. All of this will continue filling into the east overnight. I don't expect many impacts for the Treasure Valley. Temperatures will climb up to about 70 degrees again tomorrow, so a pretty nice day. Sunshine in the afternoon. We may have a sprinkle or two in the morning across the valleys. The further north and west you go from Boise, the more likely those rain chances become. So for instance, McCall's timeline for tomorrow, we will see rain across the west central mountains in the morning, potentially a couple of thunderstorms firing off as the sun emerges in the afternoon. So a little bit unsettled for the west central mountains, Valley County, northeast Oregon, maybe Washington County tomorrow. Magic Valley, I think you're quiet outside of some wind that will accompany that impulse tomorrow. Morning lows will be around upper 40s, about 50 degrees for most of the Snake Plain, 30s and 40s in the mountains. Daytime highs will climb into the mid 70s for the Boise area, 72 or so for Nampa, 72 in Jerome, 60s for Haley and Fairfield. After that, we'll see temps hold steady on Friday. Another impulse coming in could send a couple showers back to the mountains on Friday. I know we're all eyeing the weekend though. Memorial Day coming our way on Monday, and we will head into the holiday weekend with a warming trend. We're back into the 80s on Sunday. We stay very warm through at least the middle of next week.
All right, let's get to some of your comments to end our program. Let's take a look. We'll start with this. Jack in Boise. I wish the current administration would have to come up with a better system for health care coverage before they destroy what we already have. That's talking about the potential for federal Medicaid cuts. To be clear, nothing has been decided on right now, but we do know that the conservative majority in D.C. has really lined up some ideas to cut Medicaid. Elle in Nampa writes, Joe, we do not have to choose between cutting Medicaid or cutting Social Security. We just need everyone to pay their fair share in taxes. That's a good point. And if my comment earlier to Aspen was taken the wrong way, I wasn't saying it was an either or. I'm just saying that's how some lawmakers in D.C. are framing the conversation, knowing that nobody wants to see Social Security cut. Tony writes, hashtag the 208. We know who is more likely to die of the pandemic, the unvaccinated, the poor and the uninsured, the old and the very young. Talking about the measles outbreak. Again, if you're an adult and you aren't sure if you're vaccinated for the measles, you can go get a vaccine, the MMR vaccine. That includes measles, mumps, and rubella. And then kids, when they turn 1 year old, they're eligible for their first dose. Pat in Boise writes, I had measles before there was a vaccine available. More than 55 years later, I still vividly remember how sick I was. Yes, just because you get measles and recover does not mean your neighbor will. So just a PSA this summer. All right, we'll see you tomorrow.
Continue with us and watch free now on the KTVB Plus app everywhere you stream.